confirm the disposable endoscope valve system are compatible with the endoscope. Check the expiration date printed on the label and confirm the product is not expired. Do not use if there is any sign of abnormalities such as stains, wetness, tears, or any other indications that the packaging has previously been opened or compromised. Installation. Push the disposable air-water valve down onto its holder until it snaps into the place. Depress and release the valve a few times to ensure it moves smoothly. Push the disposable suction valve down onto its holder and then rotate it into the slot until it snaps into place. Depress and release the valve a few times to ensure it moves smoothly. Caution: if the suction valve is not snapped into place and is tilted in the endoscope holder, this could cause the stuck of suction valve when depressing repeatedly. Push and twist the disposable biopsy valve down onto the instrument channel port until it snaps into the place. Ensure disposable biopsy valve is tightly attached to the instrument channel port without gap. Attach the water jet connector to the endoscope's auxiliary water port by engaging the thread slowly until you feel resistance. Then, attaching irrigation system to the other end of water jet connector. Caution: if attaching irrigation system to water jet connector first, the tubing torsion may happen when attaching to the auxiliary water port. Operation: use a finger to block the cover vent on the disposable air-water valve, thus delivering the air. Use a finger to block the cover vent on the disposable air-water valve while pressing it all the way down, thus delivering the solution. Press the disposable suction valve all the way down, thus aspirating the solution. Insert the endotherapy accessory through the slit of the disposable biopsy valve. After use, slowly withdraw the endotherapy accessory. Caution: during the process, always check and ensure the valve cap is closed. If the diameter of the endotherapy accessory is greater than 3 mm, should open the valve cap for introducing and withdrawing the endotherapy accessory. Bedside pre-cleaning after procedure. Turn off the airflow regulator on the light source after initial rinsing of the endoscope, according to facility guidelines. Remove the disposable air-water valve, disposable biopsy valve, and water jet connector. Push the air-water channel cleaning adapter onto endoscope, air-water channel, until it snaps into the place. Place the distal end of the endoscope into a basin of water. On the light source, turn on the airflow regulator and set it to maximum output. Press down the button of air-water channel cleaning adapter for 30 seconds. The water is fed through the air-water nozzle of the endoscope to clean the nozzle and air-water channels of the endoscope. Release the button of air-water channel cleaning adapter. Air is continuously fed through the air-water channels. Keep the distal end of the endoscope in the basin of water. Flush the air for 10 seconds. Turn off the airflow regulator on the light source. Remove the distal end of the endoscope from the basin of water. Remove the suction valve and air-water channel cleaning adapter. Discard all the valves after each patient use in accordance with accepted medical practice and applicable local laws and regulations.